cultural competency and cultural humility in healthcare. To me, cultural competency includes effectively communicate and provide patient care to people from different backgrounds. It means recognizing people, cultures, values, beliefs regarding the care, even socioeconomical status that may affect the health care. Also, cultural competency is very important, but cultural humility is even more important. Why? Because while cultural competency is a static process, cultural humility is a life learning process, which includes learning about people's values, beliefs, and be openness to other people's experience. It also includes recognizing our own bias regarding the care while building the patient and the clinician relationship. How can I apply cultural competency and cultural humility to the clinical practice? Well, one way is to use evidence-based tools available, such as the LEARN tool, which include learning, explaining, acknowledging, recognizing, and or recommend, and also negotiating with the patient the plan of care. It also includes being aware of our own bias. It also includes avoiding assumptions. It also includes taking into account other people's different language and way of communicating, whether it will be verbal communication, whether it will be whether it will be mannerism, and different language, which in such a case includes also having interpreters available to allow a clear communication and also to be cognizant of any different of meaning that may appear, such as difference of language and language barrier. It also includes engaging in an active listening, allow patients to express their own understanding regarding their health status, allowing us to assess the patient health literacy and understanding of the instructions or the care that we are suggesting or recommending to them. It also means tailoring the plan of care according to their values, while still ensuring that they do the recommended treatment and the recommended plan of care, and ensuring that our interventions are effective. For example, let's pretend that I'm treating a Latina mother postpartum and she's having postpartum depression. I am suggesting a plan of care to that patient, yet she prefers a curanderism, which is a practice that is very common in the culture. If on my place as a nurse practitioner, I will explore the practices that support her belief. I will try to find a provider. I will refer to a psychotherapist that is probably bilingual, that is probably more knowledgeable of the curanderism, and I will also try to include her curanderism practice and to their care, ensuring that she is compliant and that she is listened and acknowledging her culture and her belief. Now, we in cultural competency and cultural humility, we also face disparity. There is several disparities in mental health. To address those disparities, we need to increase access to bilingual providers. Mental health. We need to promote community care education to reduce the stigma of mental health cares. And also we need to ensure telehealth services to allow more people to have access to the health care. Also, we must encourage policy changes to address those inequalities on the care. I think by embracing cultural humility and by practicing cultural competence, we should be well informed to the more recent evidence-based care, and we should try our best to engage engage in that life learning process, as well as building trust with our patient and create that foundation that provides the effective care.